Hi everyone, it's Dr. Karen Leggett, the Women's Midlife Specialist, and another Anti-Aging Secrets on the way to work. I don't even know what number it is. We're in the 60s somewhere. In any event, today we're going to talk about what happens to your bones as you get older and start losing hormones. The first thing you need to know is that estrogen is extremely important for bone maintenance. So the strength of the bones is very dependent on the estrogen that you have in your body. Progesterone is also important. As progesterone declines, bone density declines. Guess what else is important? Testosterone. So all three hormones, estrogen, progesterone, and testosterone, are vital to the strength of your bones. So around menopause, it's actually about 2 to 3 years before menopause and 2 to 3 years after menopause. That's when you lose your bone mass at its fastest rate. Okay, that's really important to remember. Now, what I'd like to show you first is, well, this is a replica of your spine. This is a pelvic bone, and this is the hip and the femur, or the leg. So close up, I'd like to show you what two vertebrae look like. Now, this is normal vertebrae. These are nerves coming out from the spinal cord. Here's the spinal cord here, and this is the disc that is in between each vertebrae. Now, this is a normal vertebrae with the bones nice and strong. Now, as we get older, if we lose bone mass, this is what it looks like. So you can see that they become very compressed and shorter. So you can see why we start getting shorter, and we start having very high risk of fracturing these bones. That's the vertebrae. Now, what's also important is the most common place other than the vertebra where we can have what's called compression fractures are in the hip. Of course in the wrist, but in the hip. And what I'd like to show you there is, let's take a little pin. Right here is a common fracture point. Of course, you can fracture here, but this is very common area to fracture the bone, because as you see, it's not that wide here. This is called the neck of the femur, or the neck of your leg bone. So this is a common area where women fracture their hip as they develop osteoporosis. So don't let that happen to you. Test your hormones and see what you can do to keep that bone nice and strong. Okay, see you tomorrow. And tomorrow we'll talk about, should we talk about the heart, or should we talk about the vagina, or should we talk about the musculoskeletal system? Let's talk about the heart. Okay, see you tomorrow. Bye-bye.